All right, good morning. So hopefully this is the first video you're looking at with IMS. I'm trying to make this as the more comprehensive one, which is the first one. So after you log into IMS, let's say you are looking at the patients, the first patient of the day. What you'll probably get to is that you need to get to is that after you sign in, you need to click on this little option right here where it says check in and check out. That will typically show you, and I'm already at the screen, so it won't show you anything. This is also option F10 as the keyboard. This will definitely show you the procedure and schedule for today. So in this procedure today, we already talked about there are 4 patients, and we did procedure notes and follow-up notes for 4 patients today. But this 5th patient, what I would like to do is show you the actual start to finish new patient evaluation for. So this patient is actually listed at 10 o'clock, called test MIPS. This step, the MA should have already done it for you, but let's say if they didn't, let's say the patient is here, and we can double click it to check them in, and it's gonna say, oh, there's a little note. So we're gonna click that, okay, and after that we will get to this window. So the window patient is checked in at 12, and then at this time, it's gonna ask for some forms. We're gonna skip that for now. So after this patient is checked in, it's got a green smiley face, and you're gonna have a couple of things. This is the sign off, this is the super bill, and this is the vital. So in this patient, we're gonna say, okay, these notes are all signed off. So I do not have a note yet. I do not have sign off or anything. None of these are checked. So we're gonna double click this one more time. This step your MA should already do it for you, but so right now we're gonna create a new visit note because no one has done it for you. If your MA already created a visit note or you need to double click it, it's gonna directly load you in the visit note. So since we have no visit note, we're just gonna be the one adding it. So after that, you're gonna be taken to a screen where you have a lot of stuff on the left side menu and then stuff actually in the body. What you're basically trying to do is that you're basically trying to fill out left to bottom any information that you feel like is relevant for this patient's note. So starting from the first one, in general, you can choose if this is an office note, if it's a hospital note. So I think most of the notes are going to be office notes. Sometimes we're going to have some procedure notes. And then you can, if you want to choose the MA, or if the MA is starting note, they can put their name in. You can choose who's the performing provider. So in this case, I'm the performing provider. But if you are a PA, you can say add a row or F11, and you can choose to say supervising, and I am Melissa Caro, and actually reverse. Just kidding. So performing is Melissa Caro, and then supervising is me. And then you can choose to see if you need double sign off or just single sign off for the note. So let's just say we need double sign off. And then this thing will say bill under. But we're gonna go back and just say delete one of the rows, and I'm just gonna say I'm the performing provider, which is right here. And I'm just gonna say okay. And first thing, I know the diagnosis is listed so much in the beginning. We actually put this super high up so that we don't forget to put the diagnosis for the procedure. So for the diagnosis, I know it's really early, but let's say if you already kind of know what the diagnosis would be, you can go to a miscellaneous. So we usually include opioids for new patients. And then we also include, let's say we see the patients with lower back pain. We'll include some lower back, lumbar radiculopathy, lumbar spondylosis. And then I don't see chronic pain here. So make sure you add the 3 that you added here. And then, so the patient already has some previous existing diagnosis. So those will be listed already, and then we just added a bunch on top. But let's say I want to search for something new. So let's search for chronic pain. So after that, I got a bunch of chronic pain. So let's say we want some chronic pain syndrome. So we'll say okay, and that should be added as the 7th because we started with 3 diagnoses. We add another 3, and then this is the 7th one. So we'll click okay. So notice is that the diagnosis is listed super high, but the diagnosis will be listed in the actual note super low. So you can we actually set it to have the diagnosis kind of super low just in front of the assessment plan. So don't worry about it. And all of these options, you're going to have a left option and a right option. So that left option, you essentially click a bunch. The right option is just free text. So in this left option, let's see what it looks like. So if you click on allergy, the allergy, you actually, believe it or not, in this situation, you actually have to add an allergy called no-known drug allergy. The other medications you just search for. So you search for that and you say close, and then you say okay. So when that's done, the no-known drug allergy will show up here. It will also show up right here. But let's say you want to just free type because you're tired. You can also free type no known drug allergy here, and you'll see the difference. So the no known drug allergy will show up here, and anything you free type is going to have 3 asterisks next to it. So you're going to see asterisk, 3 asterisks, and then this is known that you should free type. Notice that this won't show up on the top tab. So if you want the allergy to show up, you better click on and add individual allergies. And then chief complaint. So this one, once again, you're gonna be able to click on the chief complaint you have, or you can just free type. Sometimes I feel like it'd be easier just say free type. Let's say lower back pain for this patient, and then your HPI. So in this particular case, I'm gonna cheat a little bit. So let's say I've been using Doximity. I already had an HPI done, so I'm just gonna copy from the other window and copy the HPI. And so here's what I have. I have the HPI, and this is what I have. I'm gonna have something about the patient, where the imaging was done at, what the patient has tried, what kind of therapy has the patient tried, and then if the patient has tried any procedures, the patient has seen any surgeons, and then who's the referring provider. So again, this is a format that I use, but you don't have to use this. It's just something I use. And so I click OK. Obviously, you can free type, or you can just do the click options here. I'm not a big fan of click options because I feel like the AI scribe helps me quite a bit, so that's what I use. I use Doximity. And so I do that, and then family history. Again, you can click it. You can do non-contributory. For the sake of this, I'll just click non-contributory. So, and then the next one we'll do medical history. So medical history, the one thing I do want to make you known is that in medical history, the surgical history is actually in part of the medical history here. So if you want to free type, make sure you type those. So I'll just click a couple of things here, and then I'll say okay. And then the next thing is social history. Social history, you can free type, or you can just click. And so I'm just gonna say no, lives alone, no members household, no recreational drugs, no alcohol. And then I'm gonna click OK. And then after that, we're gonna do review system. So review system, again, you can free type. So I did skip current medication because the patient's last medication has been put in previously. I know we put a new patient in, but this patient actually has some current medications already. But if you don't have medication, you can click here and you look up medication. So let's say this patient had medication lookup. Let's say it's we're looking up for he takes Norco. So you can actually type that in and it'll go to a different option where you search for it. So we're gonna do hydrocodone and then go to next. Oh, sorry. So when you're doing the current medication, you actually need to hit add here. Drug lookup is just if you search within this. So for example, if you search warfarin, it will search here. But if you need to actually add something, it'll be here. So you can do hydrocodone. And so that would show up with hydrocodone acetaminophen. And from that, you can either add favorite list or you can create your own. So I'm going to say hydrocodone, the patient takes 12 BID. I'll say that. That looks pretty good. It says drug-drug interaction. So I say yes. And then, okay, so I added that medication. And then you can add a couple of more medication. Review systems. Again, you can click on it. If they are negative, you can just click on a bunch of negative and then let's say positive for MSK. And let's say for this patient, we got some lower back pain. So I got some muscle cramps, I got some back pain. And then the other ones, I'm gonna say negative, 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 negative. And then I'll click OK. And then the next option would be the vital sign. The vital sign, I do not have an MA today at this time, and hopefully your MA put this in for you. So I'm going to say 180 or 120 over 80, and then pain at 8, and then the other stuff I'll skip for now. So after the vital sign, we will get to the green light. The green light is pretty simple. You just click on the data service today, so 2025. And then we're gonna do 1, 1, 1, 1, 2, 1. This is free type and you can type anything you want. And then that should show up as a green light questionnaire. UDT, this is probably not gonna be applicable for the first UDT that's done, but this is actually supposed to be the UDT results. You can say result from 2025 and you can free type here or you can individual click on each one. Another way of doing it is clicking on the side over here and you click on actually UDT done 20 at 2025, UDT positive for Norco. Again, I highly recommend for the follow-up patients, especially medication refill patients, you put this here. That way other people can copy previous UDT and they can review what you had previous UDT. If you want to use this, you can. This is if you record any previous MRI, X-ray you reviewed. I personally just put it in the HPI because the imaging MRI in the back is pretty important to me. And then procedures. This is actually usually for procedure documentation, so we'll leave that alone for the new patient. And then unless you're doing a new procedure in the same day. And then physical exam. So physical exam, you can do it two ways. One way is you can actually just click on what you can. So this first one, it has physical exam for almost all the other body parts. And then the body parts that we're focusing on is here, lumbar. So you can click on, there's dermatome, reflexes. You can click on anything you want. And under, just want to make a note, on the orthopedic exam are all the other random exams you have. I try to put the slump, straight leg, and then Kemp's test as, and then all the SI joint maneuver as first. And then the other ones, I don't really do that much, but I left it alone. So if you ever use any of those, just let me know. And so the other thing you'll notice is that if the right hand side, when you click on something, it'll show up something. So one thing we're gonna do is we're gonna look at strength. So strength, we're gonna click on strength. If you click on strength, if you wanna say both leg strength is normal, so under strength, just pay attention right here. Under strength, if you wanna click it's normal, you actually click on the right hand side. So left hand side is you wanna add something pertinent. The right hand side is basically you're saying it's normal. So right here it says left upper extremity is 5 out of 5. And then lower extremity is 5 out of 5. But if you want to add something, you say, okay, so let's say a particular muscle is now 3 out of 5, 3 plus, 3 minus out of 5, or just simply 3 out of 5. You can add that individually, or you can say this particular muscle is 5 out of 5. You can click the red sign. I know it's a little counterintuitive. That's how we do it. So what if you want to load some templates? So you can actually make some templates, and if you have a specific template you want for physical exam, you can. So in this case, I want to say, let's say I just want to load a template. And so to load a template, you can go to the second row with the little icon right here. It says select template. So from here, you're going to select the template that is called, I usually use Melissa's template actually. So Melissa's template has a physical exam for, let's say lumbar. She has a physical exam for lumbar. So I like that. I dig what she has, so I'll use that. And so just remember, when you load a template, just make sure what they have in the template. In this template itself, the only thing she has is physical exam. So when you load it, it's only gonna replace the physical exam that you have already. So remember, it's gonna replace the physical exam you have already, because right now it's called overriding existing note checked. You can individualize, let's say if they have a template for diagnosis, physical exam, and review system, you can individually check each one or individually uncheck each one. So even though right now every single thing is checked right here, if I load this template, the only thing it's gonna replace is the physical exam. It will not replace chief complaint, HPI, family history, medical history, social history. Don't believe me? Let's try it out. So we're gonna copy, and we are going to go to the note again. So remember, that thing did not have anything else. So our HPI is still there, our family history is still there, UDT is still there, everything's still there. Okay, good. So the only thing that changes is that Melissa, because remember we had the physical exam with the strength, now it's not there, so we loaded Melissa's physical exam. So you could do that kind of a hybrid for new patient to save some time. You can load your template. Your template can have just the chief complaint or just the exam, or you can have a template that mixes and matches. So after that, we're gonna do our treatment plan. So treatment plan, you can do it a couple of ways. You can do it with the clicking option, so you can do free type, and you can do plan of care, and you can choose new patient visits, and then a couple of these things. If you aren't sure what that one, but you just want a free type, or in my particular case, and I do ChatGPT or I do AI Scribe, I have a plan already. So I just copy what the plan that I have. So remember, right hand side, this little notepad is free typing. So I just click on that, I copy and paste what I have. So then this particular patient, I recommend a continuous Celebrex, reassess the pain, potential flare-ups, and then monitor for symptoms if worsen, and then possible MRI. So I'll click on that, and that's okay. So we'll stick with that plan. And then if you want to do a prescription, you can click over here, and you can add on a Norco. So let's say if you don't have the hydrocodone, you want to look up. So I want to add a medication called pregabalin. You go to the bottom here. I am going to add something called pregabalin. It's probably I'm gonna have to search for it, because it's gonna have to search for a couple of different dosages. And so let's just say I want to do 100 milligrams. I know there's a tons of 100 milligrams. They're just from different manufacturers on this right side. Honestly, I think most pharmacies are just gonna have one manufacturer, so it doesn't matter. They're gonna use the one they have. So we're gonna do BID. And we're gonna do 60 tablets already selected. Pharmacy, we're gonna do HEB in Bernie. And it's gonna have 2 HEBs now in Bernie, so I'm gonna choose one. And then it's gonna say it's not default pharmacy. Do you wanna set it to default? Yes, I do wanna set it to default. And do you wanna send this pharmacy to all prescription? I'm gonna say yes. And then after that, I'm gonna say I wanna go ahead and send now. So remember, standard pregabalin is a controlled substance. We need electronic prescription. So for the providers, on your little tab, you're gonna have a option for so it's gonna say drug interaction. I'm gonna say yes, I would like to continue. So on the, let's see, must be approved with today's date. Oh, okay. So it looks like it was yesterday's date. Start date would be today. All right, so I'm gonna say save and send. And then, let's see, I'm not sure why it's not letting me send. So I'm gonna say skip and save. And then I'm gonna say send this particular medication. So you can click on this, and then you can click on this green sign here, or you can click on here. Either way, what it should do is that it should pop up a little window for you to sign it. So we'll wait. So here it says ready to be sent. Make sure you click that down, and then you say sign and e-send. And so you're gonna use your little app called Authy, and then you're gonna have that 6-digit authentication. You don't actually need to type the password. If you have the hardware token, you click here, and then you type your 6 digits. So after it's approved, I'm not gonna send this to the pharmacy, so I'm just gonna unclick it for now, and I'll say okay. So that's how you send a prescription. But if you want to send like some lab, let's say you want to do an MRI, we will do, let's do MRI of the, or let's do a urine lab. Let's do a diagnostic order. Let's do an MRI, and let's do a MRI non-con, and we will send it to So we'll go ahead and save that. And then for the lab, basically it's gonna want to ask you for location. We are already try to input the most basic ones. So the one we're gonna say, let's say we sent to Strict. Oh wait, we're at war with Strict. Okay, no, we're not sending to Strict. We're sending to American Health Imaging. That's right. All right, so after that we'll save. And let me see if there's any other things we needed to do. So we're gonna save that, and then it's gonna say instruction pacemaker. We're gonna say close. Are you claustrophobic? No. So after that, it should just say to be sent. And then we're gonna save that for now and close it. I will double check on the sent orders. I personally have not sent a diagnostic lab yet. So I'll double check to see if there's any other things I'm supposed to do. So discussion handout, if you want to do that, you can. And then after that, we're gonna show you one more thing. So the other thing you can check is you can check the PDMP for the patient. I know for some of the MAs we don't have that yet, so you can right click on this yellow man or this little man. It's gonna go to reaction. So for the PAs who do not have the access to the prescription tab, you can add a prescription request here. Just make sure when you put in that medication, make sure you drop it down and send it to us, to one of the physicians, so we can sign it. If you leave it for yourself, then we are not going to see it. What I was going to show is that under this tab, typically there's a PDMP check. So in this particular patient, it's not a real patient, so we're not actually going to have a real PDMP check. So, but in a regular test, a real patient, you'll actually have something here. So that's one way. If you right click on that little man, it's going to show you that chart view. Or you can simply click on chart view, which is right here. It's going to go to the same screen. There's another way. If you left click on the little man, you go to this option. There's a PDMP option here. Once you click on it, same thing. It's going to go to a little screen. And then after that, that little screen will show you the actual prescription monitoring for that patient. Let's see, it didn't do it just yet. We're gonna try it one more time. Okay, so I think it was trying to fetch it, and where did it go? I think it went here. So it definitely tried to pull it up 2 tabs, but same thing, no anything that showed up. So we're gonna close that. And so that's basically how you send all of those. So we're gonna sign this note at the end of the visit. So to sign the note, it's gonna be called super bill. So super bill is how we bill for our codes. So in this case, we're gonna bill for that new patient. So we did a lot of reviewing. So we're gonna do a 99204. And then make sure you add it to the charges to the bottom. After you add it, so you're gonna show 99204 that shows up on the bottom. And after that, we're gonna say sign off over here. Or if you're not ready yet, you can wait a little bit. But let's say we click on here and we say, yes, save changes. And we're gonna say sign off. It's gonna pop up to a new window. It's gonna ask you for your password. So mine's already inputted. You can either hit existing password or you can type it in here twice. So I'm just gonna be lazy and type existing password. So at the end of it, you're gonna see that this little green tab indicates that this particular thing has been signed off. So this is how you know. So if you wanna go back and addend anything, let's say you wanna change the plan, we're gonna say, you can click on here, but when you click on here, you'll notice that you cannot type unless you click on allow edit. That's a way that, and then you have to put your password in. That's basically addendum. I noticed that I misspelled something. If the symptoms is coming back, or you can say add new referral for patient. And then you can always spell check and okay. So after that, let's say we're good, we can close it. So after we close it, the note completely still signed off. You do not have to sign it again for the addendum. The other thing I want to show is that when you close this window, you'll notice that this particular note has been vitalized, which is V, super bill, and also signed off. So all 3 of those things are done. That's a pretty good sign. And if you double click on it, you can go to the note again and modify anything. Remember, when you modify anything, you have to say allow edit, and then it's gonna sign off again. All right, so that's the main overflow of a new patient. The follow-up is actually relatively similar, but there's a couple of caveats that I show you in the second video of the follow-up, so you can actually see how you can better this. And in case you don't know, I highly recommend getting either Doximity AI or something else. If you are unfortunate enough to only have an iPhone, you're that poor that you only have an iPhone, then you actually need to email Doximity and ask them to see if you can have access to the beta version. But for this Android users, you can actually just use it. But it's not bad. You email them, they'll give it to you.